Good morning, everybody. My name is Boris José Mendoza Menendez. Here, my social media and my university. My topic is artificial intelligence to detect papilledema from ocular fundus photography. Definition: papilledema is aqueous elevation of the optic disc that occurs as a consequence of increased intracranial pressure, causes short pleasure tumors, thrombosis of the cerebral venous stenosis, intracranial hypertension, impreproduction of the cerebrospinal fluid, idiopathic intracranial hypertension.
Ms. Moran, I've been told that I have papilledema. Can you tell me more about that, please? Yes, so papilledema is what we can see when we examine the back of your eyes, and what that can be is it can be a sign of raised intracranial pressure. Now, it's sometimes not very easy to tell whether people have what we say is papilledema or pseudopapilledema. And what I mean by pseudopapilledema is that sometimes the nerve looks swollen and elevated, but in fact it's not due to brain pressure. So often when we go to the opticians and they look in through an undilated pupil, they get the impression that the nerves are elevated, and that signals for them to send somebody urgently to the hospital to be evaluated. When they come to the hospital, quite often the doctors look with what we say is called an ophthalmoscope. So sometimes they're not able to put drops in the eyes, and they actually look with a torch in the eyes to have a look at the elevation of the nerves, because they need to confirm whether the nerve is swollen or not. If they're unsure, in the emergency situation, they often ask an ophthalmologist, an eye doctor, to come and have a look at the back of the eyes.
More experience of the eyes.
Yeah, and also we've got sort of more useful instruments, such as the slit lamp, to be able to have a good look at the back of the eyes and evaluate whether we think there's true swelling or whether it's pseudo swelling. So some of the causes of pseudoswelling can be little deposits, such as drusen at the optic nerve head. These are tiny little refractile deposits that we can sometimes see when we do an ultrasound of the eye. So we ask the patient to close the eye and put some jelly on, and we use a sort of device a bit like
an ultrasound.
Yeah, just like on what pregnant mums get to look at their babies. So it's sometimes a very useful way to determine whether there's drusen present or not. But sometimes it's even more difficult than that, because sometimes you can have drusen as well as swelling. So you can see that there's lots of different things interplaying. So it's always important that the diagnosis of papilledema or true swelling in both optic nerves is evaluated before invasive tests are done.
Okay, the diagnosis based on artificial intelligence of photography of the ocular fundus. In the creation of the photography of the inner surface of the eyes, which include the retina, the optic nerve, the macula, and the posterior pole, it used for diagnosis, surveillance of disease progression, or in detection programs where photos can be analyzed later. Hence, its indication to detect and evaluate symptoms of retinal detachment or eye disease, such as glaucoma.
You may have had a retinal photograph taken as part of your eye examination and wondered exactly what is my optometrist looking at. If you look at this photograph here, you can see this small dark area, which we call the macula. The macula is the most sensitive part of the eye, and in some patients, as they get older, they develop a condition called age-related macular degeneration, where they do lose some of their central vision. Over to the side here, this slightly unusual round structure you can see is the optic nerve head. You can see that it's sort of pink around the edge, but quite pale in the middle. The optometrist will look closely at the optic nerve, because this pallor, which you can see in the middle, can sometimes indicate early glaucoma. You can also see quite clearly the retinal veins and arteries. The veins are the thicker ones. They're a little bit darker in color, almost a purple color. That's because they're carrying blood which doesn't contain any oxygen, because it's going back to the heart. The arteries are thinner and they're a brighter red colour because they're carrying blood which is full of oxygen, bringing blood to the eye. It's important to look closely at the veins and arteries because this is where we see changes in patients with high blood pressure and patients with diabetes. The eye, in fact, is the only place in the body where the veins and arteries can be directly observed without making an incision. This retinal photograph is of a healthy eye, but it will still be saved in the patient's record so that when the patient returns for their eye examination in 1 or 2 years' time, another retinal photograph will be taken and the photographs can be compared. Any changes which are taking place will be spotted immediately.
Application in medicine. The usefulness of the papilledema finding in photograph of the ocular fundus examination will vary depending on the professional clinical ability and the condition under which the test is performed. In a descriptive study, 23 pictures of ocular fundus photography corresponding to different diagnoses were interpreted by doctors from different specialties. The clinical judgment of the family physician for the presence of papilledema obtained a sensitivity of 84% and certainty of 59%.
The comprehensive dilated eye exam, opening the door to preventing blindness. A doctor can detect signs of diabetic retinopathy during a comprehensive dilated eye exam. The patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. Early diabetic retinopathy starts with small red dots called microaneurysms and can progress to leaking blood vessels causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive
Pros and cons. Pros. The image can be examined by another specialist from another place and time. Provide photographic documentation for future reference. The area displayed is much larger than that seen with the portable ophthalmoscope. Cons. Few study has been identified to analyze the validity of the use of artificial intelligence to detect papilledema and other abnormalities of the optic disc from fundus photography for the diagnosis of intracranial hypertension and papilledema. Issue applied in Ecuador. There are no certified studies of a study of artificial intelligence to detect papilledema from ocular fundus photography in Ecuador. And conclusion, a deep learning system using fundus photography with pharmacological dilated pupils differentiate among optic discs with papilledema normal and non-papilledema abnormalities.
Papilledema is swelling of the optic nerves secondary to raised intracranial pressure. Therefore, in any patient who has worrisome headaches, it's important to examine the ocular fundus looking for papilledema. Depending on the duration of the pathology which has caused the raised intracranial pressure, papilledema can go through various stages. The earliest stage can be quite subtle and difficult to pick up. It involves subtle swelling of the optic disc margins, mostly where the nerve fiber layer is thickest. So to start with, this is superiorly and inferiorly, and then later nasally. As papilledema becomes more established, the swelling can progress circumferentially around the optic nerve, leading to a blurring of the optic disc margins. Established papilledema is associated with hemorrhages on the optic nerve head and also around the optic nerve head, and in addition, the central vessels on the optic nerve can become obscured as the tissue swells around them. Chronic papilledema is where the optic nerve is still swollen, but also the disc appears pale due to loss of nerve fiber layer tissue. And then we go on to the end stage of papilledema, which is called atrophic papilledema. At this stage, the optic nerve head is pale, but it is also flat due to the degree of neural tissue loss. Other important features of papilledema, including the fact that it can be asymmetrical, which is why it's important to examine both eyes, and also in chronic or severe swelling, you get associated protein deposits in the macula beside the disc, telling you that the papilledema has been there for a significant length of time.
Thank you for your attention.